We are going to talk all about veins today. So my name is Dr. Kamrani. I'm really excited to be giving this webinar with you all. It's my first one with this team. And we're going to talk about something that I really love treating. I think patients love getting these areas treated as well. So we're going to go through everything that you need to know about vein treatment. Now, before we do that, I'm new to the practice, so I just wanted to introduce myself. So my name is Dr. Kamrani. I'm a board-certified dermatologist and also a fellowship-trained cosmetic dermatologist. I went to NC State in Raleigh, Go State, for college. I was in Philadelphia for medical school, and then I did my dermatology residency at Penn State. After finishing residency, I loved injectables, lasers, and vein treatments, but didn't get as much exposure to it as I wanted to, so I decided to apply for a cosmetic fellowship. So I did my fellowship in San Diego, California at a practice called Cosmetic Laser Dermatology. It's a very well-known practice, and it's also shout out to Dr. Lisa Ishii, who also did her fellowship there as well. Some of my specialties, so veins is what we're going to talk about, so we're going to focus on that, but other things I like to do are lasers, injectables, hair loss, acne, liposuction, and then we also have some other fun things that we'll bring to you guys shortly. Outside of work and outside of dermatology, I love to do hot yoga. I love yoga sculpt. Since moving to the area, I'm looking for a good studio. So if anyone has any great recommendations, please let me know. I love to read. I just got a Kindle for Christmas, and it's like the best thing I've ever had. So these are some of my favorite authors. I got married in May. And me and my husband, we love to travel together. We just did our honeymoon in Croatia not too long ago, which was a beautiful place. And then I have 2 cats. Now, even though I am new to this practice, I'm actually not new to Chapel Hill. I grew up 3 minutes down the road from the practice. I was the first graduating class of Rashkis Elementary. Here's a not so flattering photo of the celebration day of a Rashkis opening with me walking down with my clarinet, and me and my sister at the old well when we were just little toddlers. I went to Colbreth for middle school, East Chapel Hill for high school. After graduating from state, I wasn't really sure what I wanted to do, and I got this email about a dermatology office in Cary opening up, so I applied for a job and worked as a medical assistant there, and that was my first exposure to dermatology, and I really fell in love with the field. So I knew I wanted to be a dermatologist as soon as graduating from college, so I applied to medical school, and now here we are 9 years later working as a dermatologist. I wanted to highlight a little bit about our fellowship training. So our fellowship training was focused purely on cosmetics, and a large portion of that was vein treatment. So our program director, Dr. Mitch Goldman, he's a godfather of the vein treatments. He invented all these procedures. He's written all the textbooks, done all the publications, and he's the one that trained me on everything that we're going to learn today. We're going to go through all of that together. Here's our agenda. So we're going to talk a little bit about what even are spider varicose veins, the difference between them. We're going to talk about all the treatment options, some that we've been doing, and then a couple that are new to the practice. We'll go through some before and after photos, and then we'll end with our special offer, as well as time to go through Q&A. So why do we even have veins? What are the purpose of veins? Veins are made to bring deoxygenated blood back to the heart. So basically, your heart pumps out oxygenated blood, your tissue, your muscle, your bones, they take the oxygen, and that deoxygenated blood needs to go back to the lungs, and that's done through the veins. We are strictly just talking about the legs here. So in the legs, there are actually 2 systems. There is a deep system, which you can see in this teal kind of Carolina blue color, called the femoral vein. So that is your deeper system. And then also in the legs, we have a superficial system. All the treatments that we're doing and everything that we're targeting is always in the superficial system. So we're not going anywhere near your deep system of your veins. We don't touch it, we don't treat it. And that's because it serves a function. 95% of the blood in your legs are going up back to the heart through the deep system. And that's why we don't treat it. The superficial system is there, but only about 5, at max 10% of the blood is going through that superficial system. So one question I get asked all the time is, those veins are there for a reason, why are we treating them? And we're treating them because they don't really serve much of a function, the superficial system. And actually, if the superficial system is not working correctly, the blood can pool in that system. And we want blood to be in the deep system. That's the one that's working. So by treating your superficial system, we actually improve your circulation. Now, what causes vein disease? Now, vein disease, everyone's vein disease is a little bit different, so we'll talk a little bit through that. But first, there are risk factors. There are things that you can control, and there are things that you cannot control. Genetics, family tendencies is a huge aspect of that. If your mom, grandma, dad, all those people have varicose veins or spider veins, you are at increased risk of having it. Being a female, multiple pregnancies, someone who might not be as active and the blood's pooling in the leg a little bit more. And then someone who has a job where they're standing a lot throughout the day. Because what's happening is with gravity, the blood is going back down to the legs and then it is pooling in the legs. So those are our risk factors. Now what happens? So basically, like I said, blood is being pushed up through the veins back up to the heart. Now gravity is going to want to push everything down. And our body has made these things called valves. So there's these little kind of V upside down shaped cusps that are put in the vein to help prevent gravity from pushing it down. It kind of pushes it up slowly and then catches it before it falls back down. Now, if you have a lot of blood pooling in your legs, that pooling is going to cause your veins to start to dilate and expand. And that happens over years. This is not something that happens overnight. So slowly over years, that pressure starts to build up in the veins. They start to expand. And now those cute little valves that were holding everything together are being pulled apart, and there's an opening in between. And through that opening, the blood starts pulling down. And so it's a cycle, right? The more blood then pools, the more valves open up, and then more blood comes down. So once that process kind of starts happening, it will just continue to happen unless there's some sort of intervention or treatment that is done. Now, what does it look like? Everyone's vein disease, everyone's legs are completely different. These are just some photos to show, but like I said, you can have both of these, you can have one of these or a combination. Spider veins, these are very common. They actually likely don't mean you have vein disease. They're truly, a cosmetic concern. Now, sometimes they can have underlying vein disease, and that's why consultation is important. Varicose veins are usually much larger. They feel kind of ropey, and they can have symptoms associated with them. They can be painful, and they can bulge out of the skin. You can have a combination of both of these. There's also a condition, we have this really long fancy word called coronaphlebectasia, and this is when you have this reticulated blue-purple collection of veins right in the inner side of your ankle. And this is actually really indicative of having some vein disease that we would have to diagnose with an ultrasound. And we're not treating what it looks like also. I'm a huge believer of also how does it feel, because symptoms are a huge driving point with this. This is not purely cosmetic. Vein disease can have pain. There can be throbbing. Restless leg is a common symptom. Heaviness, cramping. And all of these can worsen after standing for a long period of time. And that is because as you're standing, gravity's pulling that blood down, we're expanding, so all those symptoms can happen. Now, sometimes people wonder, restless leg, I have this, is it due to my vein disease or not? Sometimes we do a trial of compression socks. So you can wear a thigh-high 20 to 30 milligrams of mercury compression sock and try that for 2 weeks. If your symptoms are getting better, your symptoms are likely due to blood pooling from vein disease. If your symptoms aren't getting better with the compression socks, there might be something else going on. So how do we diagnose? So you call our clinic, I want to be seen for veins. The first thing we do is we need a consultation. I want to know what symptoms you have, what treatments have you tried, what has worked for you, what hasn't worked for you, a little bit more about your medical history and risk factors. All of those play a role in the treatments that we do. And it's not all just from history and looking at the legs. Ultrasound is a big part of that, because what I'm seeing on the legs might just be a sign of something going on a little bit deeper within the skin. And to be able to fully diagnose appropriately, that's when an ultrasound comes into play. So I wanted to show you guys a little bit about what I'm looking for when I do an ultrasound. So this is an ultrasound here on the right side. And that little black circle that you might see, that black circle is your great saphenous vein. This is a vein in the superficial system. We treat this all the time. And this is what we're looking for when we're looking at vein disease. So what you're going to first see is when I am squeezing the vein, blue is going to come up in the vein, which means blood is going back up to the heart. And that's great. That's totally normal. But what happens after is you see the color red, which means blood is falling back down. So let's go through that together and we can repeat that too. So we see that circle black in the center, that's our vein, and the blue going back up, and then that red. Blue is normal, and all that red falling back down. So we see blue, and then that red falling back down is not normal. Blood should not be falling back down from the legs due to gravity. So this person did have vein disease of their great saphenous vein, where an EVLA, which I'll go through in a little bit, is appropriate for treatment. And you're not alone. Almost 80 to 88% of people have vein disease, spider veins. 50% of people have varicose veins. Half the people on this webinar are going to have varicose veins. And out of those people with varicose veins, 40% of them are going to have some underlying vein disease and that great saphenous vein. So we'll have similar ultrasound findings to what we just showed previously. And I have it too. I'm not exempt. This is me as a first-year dermatology resident being treated for sclerotherapy because I had such bad veins. I was the person that we all practiced on. So you are not alone with that. Britney Spears has even come out publicly after her pregnancies needing an EVLA and vein treatments too due to her vein disease. So let's first talk about sclerotherapy. This is not new to our practice. Many of you might be familiar with it, but I want to talk about everything today, so we'll shortly just recap this. So sclerotherapy is very minimally invasive. We inject a liquid or foam that causes what we call fibrosis of the vein. So over time, it causes a little bit of inflammation and the vein starts to close off. This process is not immediate. It can take about 8 to 12 weeks, and it might require multiple treatments. So I like to always tell people, you might need 1, 2, or 3. Plan always in your head for 3. If you need less, that's amazing. And I like to spread it out 8, preferably 12 weeks, because it takes almost 12 weeks to see the improvement. And so we like to wait that amount of time because there might be veins that I don't need to treat the second time because they already got treated the first time. And I'm always a huge fan of doing what is the less amount of medicine needed to get to a goal result. So that's why I typically like to wait. And here's an example of a photo of us treating. This is sclerotherapy. It is small little injections within the vein, and we'll go through a couple videos together. What is the recovery like? So after we do sclerotherapy, you do need to wear compression stockings. So these are thigh high, so they start from your toes and they go up to right up to your thigh. And you wear them for 7 days for 24 hours. And that is not a typo. It is truly 24 hours, meaning you're sleeping in them, you're showering in them. I have been through this 3 times. I have all these tips that I have learned, so we can talk all about that together for the showering aspect of it. But it is really important to do this. Where I did my fellowship and training, Dr. Goldman has done all of the studies about this compression stocking, and we have found the sweet spot and what is the most beneficial amount of compression to quality of life for what is needed to get results. Anytime we do vein procedures, I love for you to walk after sclerotherapy. I have you walking right after. I have you walking every single day because that makes the medicine work better. And then no jacuzzis and hot tubs for about 2 weeks, and no hot yoga for about 2 weeks, because you guys have done this, the heat causes you to turn red, and that's because of vasodilation. And I'm trying to close the veins. I don't really want heat to open them back up. The treatment might not work as well. And always important to talk about risks. There are 2 side effects I want to highlight. So these are still on the lower side. So hyperpigmentation, I've not seen it, but it is something that's about 10 to 30% of people can get. It's transient, so it goes away on its own in less than a year. If it's not going away or it's stubborn, we can always treat it with a laser, and we'll go through a couple photos for that. So these are not my patients. These are some examples that I found that have been published in the literature. So this is someone that has some hyperpigmentation following sclerotherapy. Another condition, going back to sclerotherapy, this is also why the compression stockings are so important. They minimize these side effects significantly. So people that aren't really good with their compression stockings might even be at a slightly higher risk of developing hyperpigmentation. The next thing is matting. This is also not as common. 1% to 24% of people can get it, and this is also temporary. This is when we do sclerotherapy, and sometimes your body reacts by saying, I'm going to make a bunch of tiny little veins where the treatment was. And so this is an example of that as well. You can't really pinpoint the exact vein. This is when someone has basically their body just makes a ton of little new ones, and then it self-regulates and they start to go away on their own. Whenever we talk about veins, people are always worried about blood clots, ulcerations. These are extremely, extremely rare, even less than 0.01% of people. I like to always talk about it with patients, but it's important just to keep it in the back of your mind when we're talking about how rare these side effects are. And walking is the best thing that you can do after having these treatments. All right, let's go through some videos because that is the best way to go through it. All right, this is an example of sclerotherapy. So you can see one little injection point here, and the vein is actually going to disappear when the medicine goes in, just like that. Eventually, the vein is going to come back, and over the 8 to 12 weeks, the vein gets darker, and then it goes away. Why we see it disappear is because the medicine is actually moving the blood out of the way. So it's the medicine going in the vein, which is actually really nice. We get to see exactly where we're putting the medicine, and we know we are exactly in the vein. This other video, I wanted to highlight, this person had a large amount of veins right above their knee, and with one injection point, you're able to see the vein itself and even right above the vein being treated, because all of these things are connected. You think of it like a tree trunk. So by treating one aspect to the vein, I'm also helping the surrounding area as well. So let's go through that. So you can see that vein that I treated, and then directly above it, you're going to see that little purple disappear right where I move my finger. Let's go through that one more time in case anyone missed it. One little injection point here, and then directly above it where my finger's about to move, you can see that purple kind of moving away too. Great. And this is one of our before and afters that we'll go through in just a second too, which is good to pair it with. Okay, so let's go through some before and after. So this was a younger female, I believe she was like 33, 34. This was just with one treatment. So you can see the left, this is the before photo, and on the right, this is the after photo. So significant improvement with even just one treatment. This is another example I want to highlight. This is just 2 weeks after. So it takes 2 to 3 months to see improvement, but I like to show all stages of the healing so you mentally kind of get aware of what it will look like. So she did great. This vein actually significantly improved in just 2 weeks. You can still see it's still healing. There's a little bit of brown there as the vein starts to get fibrosed and starts to slowly disappear. So you can see there right behind the knee area. And then this is what she was after 2 weeks. This female, she was in her mid-70s, and for her, I did 2 treatments, and it was, life-changing for her. She had a lot of veins. This was someone that I did ultrasound to make sure that she didn't have those atypical findings, which she didn't, so sclerotherapy was a perfect treatment option for her. So you can see some of the before, just to highlight them, and these are some of the after 2 treatments. And then this is the video that we just watched, the second one. So showing for her, I did 2 treatments, and you can see the significant improvement after that. This is another younger female. For her, I ended up doing 1 treatment. I think she would still benefit from a second treatment, but this is just to show you what you could expect with one. Okay, so all that stuff we've been doing, it's not new, but let's talk about what is new. So when people had really bad vein disease, varicose veins, when we needed to ultrasound to figure out if there's something else going on here, we weren't typically able to do that in this clinic, but now we are able to do that. So when you come in, if I find under ultrasound that you have a great saphenous vein abnormality, like that ultrasound video that we saw, the treatment of choice is something called endovenous laser ablation, really long word. I'm going to say EVLA, and that's the same thing just for short. So EVLA is a single treatment. It's the gold standard for treating the great saphenous vein when it has disease. Basically, our process is I have you stand up, I'm ultrasounding you, I'm marking with Sharpie where the vein is, and then we have you lay down, which you can see in this photo here on the right of me doing one of the procedures. We clean everything off, we make it sterile, and then I put numbing fluid all around it. It might be hard to see in this photo, but if you can see around the skin markings, the skin looks a little bit more yellowish, whitish, and that's from the numbing that I put in there. So we numb completely around the vein. And then through ultrasound, I find the vein. I put a small little laser fiber within it. And then I heat with the laser fiber inside the vein to help destroy the vein. It's a single treatment. We just treat that one vein because that vein is what is feeding the rest of the veins in the legs. So if you don't treat the underlying cause, and we just keep doing sclerotherapy for what we see and not treating what's actually causing that, then we're not really providing the best care because you're going to keep getting veins. So rather than just putting a Band-Aid on it, I like to get down to the root cause and treat what is actually causing. And this is where a lot of the symptoms comes as well. So if you have a lot of symptoms, this is a treatment that is more indicated as well. It has a very high success rate, 93 to 97%. Now, what's the recovery? So what is it going to look like after? We go through one little single insertion site. It would be a centimeter, if not smaller, and it's right about the mid-length of the inner side of your thigh. So this is not vein stripping. We don't do vein stripping. Vein stripping's outdated. You know, this is when people were going to vascular surgeons in the OR and having this vein basically torn from their leg. They were hospitalized for 2 weeks. They were immobile, then leading to blood clots. So that is not the standard anymore for treating these veins, and this is the minimally invasive treatment for it. So after I do the procedure, I put an ACE bandage on your leg, and that's mostly because I put a lot of numbing in there, and the numbing fluid is going to want to leak out a little bit, so I put some gauze there over the ACE bandage so it absorbs in there, and so you don't have to worry about any wound care. After that, we do compression stockings, just like with sclerotherapy, and you're wearing these for 24 hours a day for 7 days, and then after those 7 days, you're wearing it just when you're awake, not when you shower, not when you sleep, for another following 7 days. You're walking every day. You walk right after the procedure, and then you're also walking 30 minutes every single day. You can break it up however you want. You can go back to work the next day. I've had patients that have done that. If you're someone who works standing on their legs all day, I would recommend taking a couple of days off just because you are going to be a little bit sore. But if you're someone who's able to sit at work and elevate your leg or work from home, then if you want to work the next day, it is possible. And then for follow-up appointments, I see you the day of the treatment. Well, first we do a consultation. Then we do a kind of pre-treatment little visit to go through everything, answer any questions. We'll do an ultrasound again, make sure everything's normal. Then we do the treatment, and then I see you back the next day. I take that ACE bandage off, we clean the site, answer any questions. I'll put the compression stockings on you. You don't have to worry about that because those can be a little bit difficult to put on. And then after that appointment, I'll see you back in 1 week. I'll take the compression stockings off, we'll ultrasound again, chit-chat a little bit, and then I'll see you back in 1 month. And if there's any, if people need to be seen back sooner, we can go from there and see if this is not completely set in stone, but this is ideally, I'd like to see you back the next day, the next week, and the next month. Now, what are some risks? Bruising is actually the number one risk, about 30%. Some people can get a little bit of inflammation of the vein, which actually is a good sign. It means that it's working, but sometimes that process can be a little bit sensitive. So we have tricks that can help with that. Nerve irritation. So if you read a little bit about this, nerve irritation was something that people were really worried about. And that's because below the knee, this vein and the nerve are right beside each other. So if you're heating up the vein, you might irritate the nerve right beside it. And because of that, we actually don't treat below the knee. We're treating the thigh because that is what's feeding below the knee for EVLAs. So this is, Dr. Goldman's standard of care who then trained us. So our goal is to not cause any nerve irritations, any complications, and safety is our number one. And so because of that, we stay above the knee. And also because of that, we don't treat this procedure with glue, which is another way to treat the vein disease. The glue has higher risks, higher side effects, and so because of that, that's not a way that we treat them, but it is commonly done in other practices. So these are some photos. This is by Dr. Goldman. So this person had an EVLA done. So the treatment was done to that vein of the thigh, and you can see after 9 months, look how much it helped that varicose vein that was lower in the leg. So by treating the underlying problem, we were able to treat the signs and symptoms that we're seeing on the leg. A little bit more about what to expect. We'll go through a consultation, the treatment day, and then your recovery where you have ACE bandage for 1 day, the compression sock for 7 days, 24/7, and then just during the waking hours for another 7 days. And then I like to wait a few months. We'll see what other veins are left over after we treat the underlying cause of the vein disease, because sometimes there are little stubborn purple spider veins or some little varicose veins that we need to treat with sclerotherapy. Okay, and then the next procedure, this is called phlebectomy. This is new to our practice, but not new in the world. This has actually been going on since 400 BC. There have been papers written about this. And this is for people that you've got a big varicose vein, but your ultrasound findings are normal. You just want that varicose vein gone. I can numb the area around the vein. And basically, I make just the smallest little poke, and I can pull the vein out through a technique and actually physically remove the vein. So this treatment is nice because you know when you leave that that vein is gone. Now, sometimes I have to combine this with that EVLA treatment if someone has vein disease. So sometimes it's by itself, sometimes it's in combination, sometimes it's with sclerotherapy. So because of that, everyone's treatment plan is just a little bit different. It's not a one-size-fits-all. And then I want to go through a couple photos, but for some people that might be a little bit sensitive to looking at treatments that can be done in the skin. I'm going to have you close your eyes for about 30 seconds just so you don't get grossed out. So close your eyes and I'll tell you when it's safe to open. So this is what the process basically is. Through a technique, I'm pulling out the vein, and some people like to see it. And so when we can save it if you want to, take a photo or look at it. But this is what a vein actually looks like. So it comes out in little tiny pieces, and it's actually very, very flat and small because when we take it out, there's no blood inside of it. So this is what it looks like. Okay, for people that close their eyes, you can open your eyes back up again. Those gross photos are gone. And risks. So bruising, still the number one cause, a little bit higher up compared to the other procedure. Sometimes people can have that hyperpigmentation that is transient in the area. Because we're making tiny little pokes in the skin, even though they're small, sometimes there is a risk of having a scar in those areas as well, about 3 to 5%. A swelling and something called hematoma are also risks as well, a little bit on the rarer side, but nevertheless, just want to go through all those with you guys. Now, this is a photo of someone that I did, and this is her 2 weeks photo. So this photo was taken 2 weeks after the procedure. So for her, you can see here, she has a pretty large varicose vein. I feel like the photo doesn't do justice to what her symptoms were and what the ultrasound looked like. I did ultrasound her entire leg just to make sure nothing else was going on, and it was just this one vein. And she didn't want to do sclerotherapy. She just wanted it gone. And so we numbed the entire area, and through 4 small little openings, I basically pulled the vein, and then these little areas will just heal up with time. She was very, very happy with it. Okay, all right, so that is the end. Things I want to remind you, vein disease is really common. You're not alone. There are a lot of ways to treat, and it can feel a little bit overwhelming for patients, all the options, but we go through it all with you. And that's why a consultation and ultrasound findings and your symptoms are so important, because not everyone's treatment plan is the same. And even though I haven't been in the North Carolina summer for 9 years now with training, but I remember how hot and humid they were. So compression stockings might be a little bit hard in the summertime. So fall and winter are the better time to do it. And that is the end. I really appreciate everyone who's listening in. I'm going to take some questions in just a minute. Here's our Instagram handles as well. We will be posting this to YouTube if you want to go through it again or want to send it to somebody or have any other questions. And then for people that attended the webinar, we are offering free consultations. So you just let us know, and we'd be happy to see you. And with that, I'm going to stop sharing here. Okay. And then I'm going to go through the question and answer. Okay, so one of our questions is, if there is a varicose vein in the lower leg, does that mean the vein in the upper thigh is not working and needs to be ablated? And second question, if this is prior to having kids, can treating the upper thigh vein now make it more unlikely to develop problems with lower veins during pregnancy? Okay, these are 2 really, really good questions. So let's first start with the first one. A varicose vein in the lower leg, you have a 40% chance of some sort of reflux or abnormality in that vein in the upper leg. So anyone with a varicose vein, ultrasound is standard of care, because if I just treat the varicose vein without confirming if there's any underlying cause in the upper thigh, that varicose vein might come back. So, or you might need multiple treatments because the underlying process is still there. So yes or no, everyone's body is a little bit different. And then second question, if this is prior to having kids, can we treat the upper vein now, making it more unlikely that you'll have lower veins during pregnancy? So this is a good question too. You know, preventative vein therapy is a hot topic. So compression stockings are your friends. I wear them every single day. I tell everyone to wear them. They're the best thing. Wearing them during pregnancy is also really helpful. I'm not a proponent of doing an EVLA for preventative measures, because it's really, you know, a procedure that you want to save if you have the conditions that it is set to treat. So if you don't actually have reflux, then I don't recommend anything that I don't think you don't need. So I wouldn't recommend the procedure. But in terms of preventative, compression stockings are your friends. And then after pregnancy, after breastfeeding, we can even do sclerotherapy if you notice small little veins that are popping up in the lower legs. So we can treat what we see, but unfortunately I can't prevent what is not coming up. Next question, can you ultrasound during the consult? Yes. So ultrasound is included in the vein consult as long as it's done on the same day. If we have to do it on a separate appointment, there is, you know, a separate appointment associated with it, but that would be if you didn't want to do the ultrasound. I would encourage the ultrasound during the consultation if I have any concerns of any underlying disease. So during that time, I mean, you're there, you can see it, I'm talking you through it, showing you, we're writing everything down too. So it's always nice to have that baseline ultrasound, because looking at the veins is just one part of the process. So if I can't see what's going on underneath, then I'm not able to provide the best treatment option. The next question is the treatment painful? So this is a question that gets asked all the time. So let's kind of break it up. Sclerotherapy is comfortable. It is like the smallest little pokes, the smallest needle size that we can possibly do where the medicine can push through. We don't do any topical numbing. You're awake during the procedure. All my patients have been very, very comfortable with it. We have little tricks of things that we can do to make you more comfortable as well. After I do the procedure, I put a little steroid on it because even though it's not painful, it's actually a little itchy. I've had a lot of itch after my treatments too, and so I'll put something on it to help with the itch before I put the compression stockings on. EVLA phlebectomy, I put numbing surrounding the whole entire vein area. We call it tumescent liposuction. So it is a numbing that has been diluted in a safe concentration that I can do in the leg. And because of that, that helps with any sort of pain and discomfort. There are other things that we can do. You know, we have something called Pronox or laughing gas. We have other things that we can prescribe if you feel like you might be someone that's a little bit more sensitive to procedures. The only thing is I love people to walk after. So I want you to walk right after the EVLA. So I don't want to give you something that's too sedating that you can't walk, because if you can't walk, then the treatment might not work as well. Okay, those are really, really good questions. In terms of pain afterwards, Tylenol, you can take 2 extra strength Tylenols to help with any discomfort and soreness that can happen afterwards. Usually patients have told me the soreness from EVLA can last, 2 to 3 days after, and it's usually just in that one area where I made my little insertion site there as well. I tell people to avoid Motrin, ibuprofen for pain because those do thin your blood a little bit. So I don't want to increase your risk of bleeding or increase any bruising that can happen as well. Okay, some other questions that patients tend to ask is how many treatments. Sclerotherapy is typically multiple treatments. Everyone's a little bit different, whereas the EVLA for 93 to 97% of people is just a single treatment, single time. And then for phlebectomy as well, it's just a single treatment of removing those veins. Perfect. Are there any other last minute questions? I'm sure you guys are all super excited about veins now. So what is the booking process? When are you taking consultations? So when you book, basically just call our clinic and say that you want to be set up for a vein consultation. The whole process is, we'll meet each other. We'll go through a whole list of questions about your vein history, what you've tried, what you haven't, what's your past medical history, what medications are you on, are you not on, any symptoms associated with it. After that, I'm going to take a look at your legs, determine, what we're seeing, kind of talk through that, and then we'll go through the ultrasound, and we'll go through the ultrasound findings together, and we will go come up with a treatment plan based on your symptoms, what we see on your exam and on ultrasound. This consultation is typically about an hour as well. And we're essentially starting to take consults starting on the 13th. I'm here. So we are ready to get this jump started. I'm really excited to offer this procedure for you guys, and would love to see you to see if you're a good candidate. Okay, another question. Assuming there's a problem with the upper vein, can treating it prior to pregnancy make the lower vein better during and after pregnancy? And yeah, so if you have a problem with the vein, the ultrasound that you have reflux, I do recommend treating it because your body this is not something that your body can fix. It's not going to reverse the reflux. Once there is dilation of that vein and those valves can't hold together like a V and they're open, that blood is going to pull down, and then it's slowly going to keep pulling down, causing the vein to dilate more and more. So it's basically like this cycle that happens. So if you do have a problem, I do recommend treatment because even if it's mild, even if it's before pregnancy, time, pregnancy, all those things can then exacerbate it and make it worse. And what happens if it makes it worse? Let's say like, oh, I don't want to do this. I have vein disease. What can happen? So over time, if it gets worse, your symptoms can get worse. You can have a lot more pain, throbbing, restless leg. Some other things that can happen is we can actually see skin changes on the leg. And when we see this, this is a clue to maybe doing an ultrasound. So you can get something called stasis dermatitis, which is this eczema-looking red-brown rash that can happen on your shins. And this is because there is so much swelling in your legs that it's kind of pushing against the skin, and so the skin changes its color just from all that fluid collection around that area. Other things that can happen, ulceration is very, very rare, but sometimes people can get something called venous ulcers. You might know family members or elderly patients that have had venous ulcers, and this is from years of untreated underlying venous insufficiency. So in residency, we treated a lot of these. Anytime there was some venous ulcer, we would always ultrasound because you can treat the skin, but if you're not treating what's causing the swelling and the ulcer, then we could never really heal those ulcers up completely. Well, I was really excited to talk with you guys. I'm super excited to be, in this practice. It's such a great practice, and there's a really incredible team here. Very happy to be back in my hometown, and I'm looking forward to meeting you all and getting to know you guys. And then if you have any questions, anything like that, you just reach out to me and let me know, and hope to see you guys soon.